Good evening, everyone. Very warm welcome to our monthly Homeo Hub meetings. Without taking any longer, Dr. Geeta ji, we look forward to hearing you on thyroid today. Thank you.
Thank you very much, Dr. Neha. So today we'll be speaking about thyroid disorders and how to manage them either medically with lifestyle changes or with nutrition or diet, because thyroid is something which we can easily manage with lifestyle changes. I'll share the screen now. So, sorry, this is the other slide. Yeah. So today we'll be speaking about how can homeopathy and nutritional help and lifestyle changes help with thyroid. Living well with thyroid disorders, homeopathy, nutrition, and lifestyle changes. So a little about your thyroid. Where is your thyroid located? Thyroid is at the front of your neck, under your skin, and it is a small butterfly-shaped gland. It is an endocrine gland, a ductless gland. What does your thyroid do? Your thyroid gland influences almost all the metabolic processes in your body through the hormones it produces. Your thyroid gland is a part of the endocrine system. Now, thyroid disorders. When your thyroid makes either too much or too little of the important hormones, it's called thyroid disease. Thyroid disease and disorders can range from a small, harmless goiter or an enlarged gland that needs no treatment to life-threatening cancer. The most common thyroid problems involve abnormal production of thyroid hormones. That is what is commonly known as thyroid disease, where there is abnormal production of thyroid hormones, either it is hyper or hypo. Too much thyroid hormone results in a condition known as hypothyroidism, while inadequate hormone production leads to hypothyroidism. Although the effects can be unpleasant or uncomfortable, most thyroid problems can be managed well if properly diagnosed and treated. Thyroid disease, types and causes. The commonest ones are hypothyroidism and hypothyroidism. Both conditions can be caused by other diseases that impact the way the thyroid gland works, or either it could be primary or it could be secondary as well. So your thyroid gland is controlled. The thyroid produces T3 and T4, of which in the blood, it is the FT3 and the FT4, which actually is the active hormones that help your body. And these T3, T4 are produced by the thyroid. The thyroid is in turn controlled by the TSH. It shows over there, TSH arrow. TSH is produced by the pituitary gland in your brain. It's just below the brain, a tiny P-shaped gland. And that produces TSH that controls the T3 and T4 production in the thyroid. And that T3, T4, when produced in the blood, a little amount of free T3, T4 is produced by the thyroid as well, but majority is activated in the blood. That is the active hormone, which actually does all the functions. And the pituitary gland in turn is controlled by the hypothalamus. So it's the hypothalamus, pituitary, and then the thyroid. And then peripherally, T3 and T4. Causes, thyroid disorders. Causes is AITD, that is autoimmune thyroid disease. It could be either Idiopathic, or it could be atrophic thyroid. Defect in biosynthesis. It could be congenital. It could be due to some resistance to thyroid hormones. It could be due to ablation, either radioactive ablation or surgical removal due to some disease or due to adenoma or due to some malignancy. Or Hashimoto's thyroiditis, that is again an autoimmune disorder. Postpartum thyroiditis is also known in 5 to 9% of females, and other is drug induced. Drugs like amiodarone and ethionamide are known to cause thyroid disorders. Hyperthyroidism. All types of hyperthyroidism are due to an overproduction of thyroid hormones, but the condition can occur in several ways. Graves' disease. The production of too much thyroid hormone is labeled as Graves' disease. Toxic adenomas. These are certain adenomas in the thyroid gland which produce a lot of thyroid hormone, the T3 and T4. Nodules that form in the thyroid gland and upset the body's chemical balance by making thyroid hormones. Some goiters may contain several of these nodules as well. Subacute thyroiditis. Inflammation of the thyroid that causes the gland to leak. Thyroiditis is inflammation of the gland due to any cause. And at times, because of thyroiditis, the gland tends to leak the excess hormones. This leads to temporary hyperthyroidism that generally lasts for a few weeks but may persist for a few months as well. Pituitary gland malfunction or cancerous growth in the thyroid gland. In rare cases, these could be the causes of hyperthyroidism, although the pituitary malfunction is less commonly known in hyperthyroidism. Next is hypothyroidism, which is the most commonest disorder of thyroid. Hypothyroidism, by contrast, stems from an underproduction of thyroid hormones. As your body needs certain amount of thyroid hormone to make energy, a drop in hormone production leads to lower energy production. Causes of hypothyroidism include Hashimoto's thyroiditis, which is an autoimmune disorder. In this, the body attacks its own cells. It is not able to identify that this is my thyroid gland. It considers it to be an alien and it starts attacking. So it is an autoimmune disorder. The tissue eventually dies and stops producing hormones if it is left untreated. Postpartum thyroiditis. This can happen anytime in the year after you give birth or have a miscarriage or abortion. It is not common, but it occurs in 5 to 9% of these females. It is a temporary condition. It usually heals by itself at times, but at times some medication is required. Hypothyroidism. Iodine deficiency is used by thyroid to produce hormones. And these are the causes of hypothyroidism. And iodine deficiency is an issue that affects several millions of people around the world, and hence the introduction of iodized salts so that iodine is easily available. Removal of your thyroid gland. If at all for any cause your thyroid gland is removed, then there's definitely hypothyroidism. Your thyroid may have been surgically removed or chemically destroyed. Exposure to excessive amount of iodine can also cause hypothyroidism. Cold and sinus medicines, the heart medicines, amiodarone, or certain contrast dyes given before some x-rays may expose you to too much iodine. Past thyroid issues. You may be at a greater risk for hypothyroidism if you have had thyroid problems in the past as well. Lithium is a drug which is linked to hypothyroidism. Untreated hypothyroidism. Hypothyroidism definitely should be treated. If it is left untreated, it leads to a grave condition called myxedema coma. It is rare, but it is a potentially fatal condition that requires hormone treatment right away. Now, babies are also affected with hypothyroidism, but that is not called hypothyroidism. We call it cretinism usually. Yeah. A lack of thyroid hormone in the system at an early age can cause intellectual disability and dwarfism, stunted growth. Doctors now regularly check the thyroid levels of most babies soon after birth. If the levels are low, treatment starts right away. The causes of hypothyroidism in babies and adults are the same: a pituitary disorder, or a defective thyroid, or a missing thyroid gland, or it could be a very small atrophic thyroid gland. Cancer of the thyroid gland. Cancer of the thyroid gland is rare and occurs in about 5% of thyroid nodules. You might have one or more thyroid nodules for several years, but before your doctor finds that they are cancerous. There might be a nodule which stays for longer, but it is not diagnosed. And then when it increases, probably the size or the function, or if you have symptoms, only then you realize that you are suffering from malignancy of the thyroid. If you have had radiation treatment, this is very important. I always tell my patients, if you go for a mammary mammogram, please ask for a thyroid guard. Whenever you are exposed to radiations for mammography, they should be having a thyroid guard, so that radiation don't reach the thyroid, because radiations to the thyroid are known to cause malignancy. If you have had radiation treatment to your head, neck earlier in life, possibly as a remedy for acne or even during mammography, as I suggested, you may have a higher risk of having thyroid cancer. Take medicines that have, or you're taking medicines that have iodine excess, or 60 years or older people are more prone to have any kind of malignancy. And if you have had a previous thyroid condition, or thyroidectomy, or radiation. Radiation is one of the commonest cause of thyroid malignancies. Signs and symptoms. Signs and symptoms of hypothyroidism. Fine brittle hair and hair loss. These are hyperthyroidism, when the thyroid hormone increases. There's increased perspiration. There is enlarged liver, nausea, vomiting, diarrhea. There are tremors in the hand. You can right away just ask the patient, as soon as the patient comes into the clinic and you suspect hyperthyroidism, just ask the patient to have their hands outstretched, and you'll find there are fine tremors in their hands. That is the diagnosis of hypothyroidism. Excessive production of thyroid hormone. There might be bulging eyes as well. Enlarged, you can see the thyroid gland over here, which is enlarged. Abnormal heart rhythms. Usually there's tachycardia. The heart rate is increased. There's appetite is increased. But in spite of the increased appetite, you'll find loss of weight in hypothyroidism. The appetite will be more, but they won't gain weight. And there's loss of libido, there's amenorrhea, there's irritability, hyperactivity, high blood sugar levels, intolerance to heat, low serum cholesterol, whereas it's opposite in hypothyroidism. There is intolerance to cold. Signs and symptoms of hypothyroidism. Thinning of hair is common in both. Puffy face in hypothyroidism. Dry and coarse skin. Constipation, whereas in hyper it is diarrhea. Cool extremities and swelling of the limbs. The shin part, the lower legs especially, are swollen. The thyroid gland does not produce enough thyroid hormones. That is when it is hypothyroidism. There is loss of eyebrow hair, especially the outer 1/4. You'll start seeing that the outer 1/4 of the eyebrow hair has started disappearing. That is one of the signs of hypothyroidism. Enlarged thyroid, slow heartbeat, poor appetite. In spite of poor appetite, the weight increases. So there is weight gain in spite of poor appetite. Infertility and heavy menstruation. Whereas in hyperthyroidism, there is amenorrhea or scanty menstruation. Carpal tunnel syndrome is one of the commonest findings in hypothyroidism. There may be weight gain, there may be poor memory, intolerance to cold, feeling of tiredness and lethargy. Sluggishness is the symptom of hypothyroidism. Everything becomes sluggish, everything slows down, heart rate slows down, body slows down, lassitude, mind slows down, brain slows down. The intestine slows down and hence constipation. So everything slows down is hypothyroidism. Hyperthyroidism, everything increases. Hypothyroidism in children. It could be congenital, where it is called cretinism, congenital cretinism. There are delayed milestones. The walking, talking, sitting up, everything is delayed. Constipation, growth retardation, scholastic backwardness, psychomotor retardation. The motor activity is also delayed. Depression, the child is, he will stay aloof and gloomy, not very happy child, you can say. So in such cases, you must get the child tested for thyroid hormones. Investigations. What are the basic investigations to see whether your thyroid is normal or euthyroid? The normal thyroid is called euthyroid. And if it is increased, it's hyperthyroid. If it is decreased, it's called hypothyroid. So the functional evaluation can be done by looking at the TSH, T3, T4, or the free T3 and free T4, and the thyroid antibodies, which is really important. And then morphological evaluation can be done by ultrasound scan or radionuclide scan and FNAC. FNAC is fine needle aspiration biopsy is FNAC, or a CT scan. Okay. And hormone profile. If the T3 and T4 are high and TSH is low, because T3 and T4 are high, so the TSH is low, the pituitary thinks that there's enough hormone, so it will lower the TSH, that is hyperthyroid. Whereas if in the periphery or in the bloodstream, if the FT3 and FT4 are low, the brain gets the signal that, oh, the thyroid hormones are low. So it produces more and more TSH. The pituitary will get stimulated, so the TSH will be high, and FT3 and FT4 will be low in hypothyroidism cases. TSH screening is necessary in majority of cases, especially preoperatively. It is to be screened just to see whether the surgery, post-surgically, how would be the recovery. If there could be any complications during surgery, it is important to get the TSH screened. And if there's bradycardia, it is important that you screen for hypothyroidism. If there's weight gain, it is important that you get tested for hypothyroidism or the TSH. And GERD is associated with hypothyroidism. Constipation is associated with hypothyroidism. Menstrual irregularities, if they are scanty or amenorrhea, there could be hyperthyroidism. And if the menses are heavy and there's menorrhagia, the possibility is hypothyroidism. Infertility is common in both the cases, hyper and hypo. Preconception counseling is important with patients suffering from thyroid disease. Early pregnancy, there are a particular range of the thyroid hormones which should be maintained throughout the pregnancy. So it is important to get counseled when you are in your early pregnancy. Or if there is vitiligo, it is one of the signs of hypothyroidism. So if you have vitiligo, it is important that you get yourself tested for thyroid disorder. Thyroid and pregnancy. Pregnancy and hyperthyroidism. If you're pregnant and you're suffering from hyperthyroidism, you might have symptoms like hyperemesis, preeclampsia, heart failure, fetal loss. There might be premature labor. There might be low birth weight baby, or even the baby can have hyperthyroidism. So there could be neonatal hyperthyroidism as well. Pregnancy and hypothyroidism. As I mentioned previously, in the first trimester, preferably the TSH levels should be between 0.1 to 2.5 micro international units per ml. And in the second trimester, they should preferably be between 0.2 to 3. Third trimester, 0.3 to 3. This shouldn't go higher. Ideally, that is the best range. And this is suggested by the Thyroid Association guidelines. The obstetric outcome. There could be fertility issues, there could be recurrent abortions, miscarriages, there could be abruptio placenta, there could be postpartum hemorrhage, there could be gestational hypertension, intrauterine growth retardation. Whenever you have these issues, you should definitely check for your thyroid hormones. And this is why it is necessary to check your T3, T4, TSH before pregnancy and during pregnancy. Also, while you're conceiving, trying to conceive, or if you're not able to conceive, you must get your thyroid hormones tested because they are a high contributing factor in fertility. Role of stress. Stress is one of the important causes of thyroid disorders. If you are sick, if you don't have enough time, if you are overworked, you have health issues, you have fear, you have stress, you don't sleep well, you are very tired, you have constant headaches, there is workload, there's work stress, work-related stress, stress at home, late nights, time management is not proper, or there's anxiety, there's fear, all these things, usually they attribute to increase in stress. And stress is one of the major causative factors of thyroid disorders. It does create imbalance in the thyroid hormones. So there are some tips for well-being which can help with your thyroid disorders. Meditation definitely helps. If you meditate and you keep yourself stress-free, and if you just calm down yourself in a way, it helps you reduce your thyroid disorders. It helps you manage thyroid disorders. Yoga overall is helpful, but especially the Ujjayi pranayam is known to help with thyroid disorders. Counseling, as in I just mentioned that stress is one of the major causes. So counseling can be helpful with thyroid disorders. And this is the reason why we have this Faith Fitness program with Faith Homeopathy, which is 3-in-1 online program where you get personalized nutritional plans. You have lifestyle advisors to suit your daily routines. We have online group fitness sessions to suit your ability, provided by experienced fitness trainers. And we have you can be a part of a motivating online community for weight loss. Homeopathic remedies based on thorough assessment are also given. So this program is a perfect fit for people suffering from thyroid disorders. How homeopathy helps? You have a stressful lifestyle and sedentary life habits, inadequate sleep, fatty foods, lack of exercise, environmental stressors. All these factors lead to obesity. Obesity leads to insulin resistance. Insulin resistance leads to hormonal imbalance. Hormonal imbalance will lead to hypothyroidism or polycystic ovarian disease as well. And these changes in hormones will lead to mood changes. Mood changes could be anxiety, could be depression. Again, these mood changes will lead you to stress. So there is a stressful lifestyle, and then this all goes on and creates more stress. So it is a vicious cycle. This needs to be cut down. And it is here where homeopathic remedies help. They will break this nexus to bring back the metabolic equilibrium. Homeopathic treatment for thyroid disorders. I'll mention a few remedies. And there are thousands of remedies, of course, based on individual assessment. We usually give the remedies. It is not one fit for all size kind of thing, but we'll definitely speak about a few remedies. Sepia functionalis used when the patient presents with the following symptoms: weak, slightly yellow appearance, a tendency to faint, especially when in cold temperatures, extreme intolerance to cold, even in warm surroundings, the patient feels cold, increased irritability, hair loss, increased menstrual flow that occurs ahead of schedule, constipation, increased desire for pickles and acidic foodstuff. If you have these kind of symptoms and you are having a history of some stressful past or some trauma, mental trauma in the past, then this is a typical remedy which might help you with your thyroid. Calcarea carb, the most popular homeopathic medicine, which is useful when patients present with the following symptoms of hyper or hypothyroidism. The patients usually are fat, flabby, fair persons, and there is increased tolerance to cold, excessive sweating, especially the head. It's so typical that the patients will come and complain that I keep my head on the pillow and the pillow becomes wet. So much is the sweating on the head with calcarea carb patients. There is aversion to fatty foods, peculiar food habits, including craving for eggs, craving for chalk, pencils, lime, increased menstruation that is also prolonged and associated with feet turning cold. Homeopathic treatment for thyroid disorders. The homeopathic medicine iodum is very useful for patients who suffer these symptoms. Good appetite. The above two remedies are very good for hypothyroid cases. Calcarea carb, at times, one of the other compounds, calcarea phos, can be given for hyperthyroidism, but iodum is typically a hypothyroid remedy, where the patient will complain of good appetite but lose weight quickly, tendency to eat at regular intervals, excessive warmth, and needs to stay in a cool environment. The patient feels very hot. There's anxiety about the present, excessive palpitations, and the other remedy is Lachesis mutans. The homeopathic remedy Lachesis mutans is very useful, and the symptoms this remedy can treat are feeling extremely hot, so inability to wear tight clothes. They feel as if they are feeling constricted with tight clothes. They want to remove the tight clothes and wear some loose clothes. Generally, these people are sad with no inclination to do any work, no desire, tendency to stay aloof and alone. But once they start talking, there's excessive talkativeness. From one subject, they'll go to another, and then there's no link between two subjects, but they just want to talk and talk and talk. So in such cases, Lachesis mutans is one of the good remedies, and it affects usually the women around menopausal age. Homeopathic treatment for thyroid disorders. Lycopodium is one more remedy, and other remedy is graphitis. Lycopodium is suited to patients who are physically weak. There's increased irritability, excessive hair fall. The face is pale yellow with blue circles around the eyes. There's craving for foods that are hot and sweet, acidity that is worse in the evenings, gastric issues including excessive flatulence, constipation with painful, hard, incomplete stools, and graphitis presents with obesity, intolerance to cold, emotionally depressed, timid, indecisive, weeping, listening to music, bloated and gassy abdomen, chronic constipation with hard, painful stools. So that was about some homeopathic remedies which can help with thyroid. There are, as I mentioned, many remedies, and based on the individuality, after a detailed case taking, we can decide what remedy can be given. Nutrition and hypothyroidism. Hypothyroidism, usually if you see a food free of gluten and ultra processed foods helps in patients with hypothyroidism. Gluten is a group of proteins found in wheat, barley, triticale, and rye. Some studies suggest that people with Hashimoto's thyroiditis may benefit from following a gluten free diet. This is not necessarily proved, or you cannot say that everybody with hypothyroidism will be helped with a gluten free diet, but you can definitely try it. You can see it for a month or two and see how it goes. If it helps you, then probably you are affected by gluten intolerance. Or if it doesn't make any change, you can again go back to your gluten diet. Additionally, people with hypothyroidism may want to avoid foods that contribute to oxidative stress and inflammation. So basically, you need to take an anti-inflammatory diet. So foods like ultra-processed foods, foods and beverages high in added sugar, and fried foods are to be avoided. The factors contributing to oxidative stress are a diet high in these foods, and they are linked to obesity as well. So cutting back on these products could also help people maintain a healthy body weight along with reduction in the thyroid hormones. Goitrogens are substances which are found in cruciferous vegetables such as cabbage, Brussels sprouts, and soy products. They may interfere with thyroid hormone production. Most people, including those with hypothyroidism, can enjoy moderate amount of goitrogenic foods without negatively affecting their thyroid health. But you cannot have soups of these things, or you cannot have them excessively. Cruciferous vegetables like broccoli are actually quite low in goitrogens, so you can have them. Plus, cooking goitrogenic food reduces goitrogenic activity, making them safer for people with hypothyroidism. So it is better to take in moderation. That being said, it's a good idea to avoid consuming large amounts of juice made with raw cruciferous vegetables. Goitrogens. People with hypothyroidism may want to avoid eating large amount of cabbage, Russian kale, bok choy, Brussels sprouts, soy, and pearl millet. These are all goitrogens and can affect the thyroid hormone production. It can affect in both ways. In general, people with hypothyroidism may want to avoid eating all these goitrogenic foods. Foods for hypothyroidism. These are good foods. Non-starchy vegetables like greens, artichokes, zucchini, asparagus, carrots, peppers, spinach, and mushrooms. They can be helpful. These are healthy foods for your thyroid. Berries, apples, peaches, pears, grapes, citrus fruits, pineapples, and bananas can help with reduction in thyroid hormone because they are all rich in B complex vitamins. That is one of the reasons as well. Starchy vegetables, sweet potatoes, peas, or butternut squash are healthy. Fish, egg, meat, and poultry. Fish and shellfish, eggs, turkey, chicken, you can have these in moderation. Healthy fats like olive oil, avocados, avocado oil, coconut oil, because they contain MCTs, which are good for your body. They help, the MCTs also lower your obesity. So definitely they are good for your thyroid as well. Unsweetened coconut or full fat yogurt. This is a type of fat I'm mentioning. It is not that you should eat full fat yogurt, but if you're not taking any other fat, you can have full fat yogurt. Then gluten-free grains like brown rice, rolled oats, quinoa, and brown rice pasta seeds. So these are the things which you can happily have if you're suffering from hypothyroidism. Nuts and butters, almonds, cashews, macadamia nuts, pumpkin seeds, and natural peanut butter. These are foods that are good for your thyroid. And especially Brazil nuts, I have mentioned it further, I think. Brazil nuts are good for your thyroid because they are high in selenium. So that is one thing which is really important. If you're suffering from hypothyroidism, every single day you must take 2 Brazil nuts. Beans and lentils. Chickpeas, kidney beans or lentils are helpful. Dairy and non-dairy substitutes, coconut milk, cashew milk, coconut yogurt, almond milk, unsweetened yogurt or cheese. Spices, all spices are good basically. Any spice is good for your thyroid affections. But spices like paprika, saffron, turmeric, fresh and dried herbs like basil, rosemary, and condiments or mustard are helpful. Beverages preferably to be taken should be only water, unsweetened tea, coffee, or sparkling water. Please don't take any fruit juices, any fizzy drinks, or alcohol. They will definitely increase your hypothyroidism. If you're suffering from hypothyroidism, cut down on all these beverages. Food for hypothyroidism. Nutrient-rich foods that improve your health may also benefit your thyroid gland. Certain compounds and supplements that may help as well. They are antioxidant-rich fruits and vegetables like blueberries, tomatoes, bell peppers, and other foods rich in antioxidants can help improve overall health and benefit the thyroid gland. Eating foods high in B vitamins like the whole grains may be also of help. Selenium. Tiny amounts of selenium are needed for the enzymes that make thyroid hormones to work properly. Eating selenium-rich foods such as sunflower seeds, Brazil nuts can be beneficial. Tyrosine. It is an amino acid which is used by the thyroid gland to produce T3 and T4. The good sources of tyrosine are meats, dairy, and legumes. So if you take dairy, meats, and legumes in moderation, it is definitely a help for hypothyroidism. Hypothyroidism and diet. There is no specific hypothyroidism diet. Just a low fat diet which is good for obesity will help with your hypothyroidism as well, except that you have to avoid goitrogens, the food which are highly goitrogenic. Eating a low fat diet with a good balance of fruits, vegetables, lean protein, dairy, and whole grain is a good strategy to work for everyone to follow. You also want to balance your calorie intake. Portion control is essential to prevent weight gain. Hypothyroidism slows your metabolism and you can put on a few pounds unless you burn off more calories than you take each day. Like previously I mentioned, it slows down everything. It slows down your metabolism as well. You should also limit salt. Salt shouldn't be more than 2,300 milligrams daily. That is around 1 teaspoon, not more than that. Too much salt can raise your blood pressure, which is already at risk when your thyroid is underactive. Nutrition in hyperthyroidism, it will be exactly the opposite of hypothyroidism. Nutrition for hyperthyroidism, what to eat and what to avoid. The only way to manage hyperthyroidism is to have a healthy diet. If you have hyperthyroidism, your doctor might prescribe low iodine diet before starting the medical treatment. This increases the effectiveness of the treatment. A low iodine diet means you should avoid iodized salt, seafood, dairy products, high amounts of poultry or beef, high amounts of grain products such as bread, pasta, or pastries, and egg yolks. Egg yolks are also high in iodine. So, in addition, you should avoid soy products such as tofu, soy milk, soy sauce, and soybeans. This is because soy can interfere with your thyroid function. Wellness tips for hyperthyroidism. Hyperthyroidism, please mind you, hyperthyroidism requires treatment. You cannot just leave it. If you are diagnosed to be hyperthyroid, please see a doctor. Don't do self-treatment. It is important to get treated. Hyperthyroidism generally requires medical treatment and monitoring by a health professional. While these natural treatments may help manage your symptoms and can complement thyroid medication, they can't replace it. You have to be under a health professional. You have to take medicines. May it be homeopathic, may it be Ayurvedic, may it be allopathic, but you have to take medicines for hypothyroidism. Eating well, exercising, and practicing self care and stress management all can help. When managed with medication and a healthy lifestyle, thyroid function can return to normal. Foods to eat for hypothyroidism. Low iodine foods. The mineral iodine plays a key role in making thyroid hormones. A low iodine diet helps reduce thyroid hormones. Add these foods to your daily diet. Non iodized salt, decaf coffee or tea, without milk or dairy or soy based creamers, egg white, don't take the yolk, fresh or canned fruit, and preferably fresh. If you can't get it, then canned is okay. Unsalted nuts and nut butter, homemade bread or bread made without salt, dairy and eggs, popcorn with non iodized salt, oats, potatoes, and honey, maple syrup. Excuse me for a moment. I'm sorry, I was muted. Hello?
So we didn't hear any of that after you came back from your break.
Oh, do you want me to do it again? I'll be happy to do that. It's just a few slides.
Yes, please.
Perfect. I'm so sorry about that. I did not realize. My father-in-law had come over. He's suffering from dementia, so I was just telling you that. And I had to settle him down. I'm so sorry about that. I never realized. Yeah. Yeah, so foods to eat for hypothyroidism are cruciferous vegetables like the broccoli, kale, bok choy. These can help you with hypothyroidism, whereas it was opposite in hypothyroidism. And the beneficial foods like bamboo shoot, bok choy, broccoli, Brussels sprouts, cassava, cauliflower, collard greens, kale, mustard, all these can help you with hypothyroidism. Whereas the foods to avoid for hypothyroidism are fish, seaweed, prawns, crabs, lobster, sushi, agar-agar, and kelp. These are foods that you need to avoid because they are high in iodine. The other foods high in iodine are milk, dairy, cheese, egg yolk, iodized salt, and some food colorings, as well as iodized water. And these were the dietary tips and in general, what can help you, the lifestyle changes for thyroid disorders. And if you need to book a pre-consultation, you can go to my website. You have the free online pre-consultation slot where we can speak for some 10 to 15 minutes and discuss about your health if we can help you, and then we can confirm the appointment for you. So these are the contact details if you need to contact me. Thank you. And I'm so sorry about the disturbance. So if there are any questions, I'm happy to answer.
So can you talk about, I have one question about acute thyroiditis.
Yes. Yeah. Yes, please.
Acute thyroiditis, I don't know if you can hear me.
Yes, I can hear you. Acute thyroiditis.
So foods, obviously it's hyperthyroidism then, isn't it?
Mm-hmm. It depends what the levels are.
I haven't.
If the T3, T4 are high, it is definitely hyperthyroidism. If the T3, T4 are low, it is hypothyroidism.
But after having acute thyroiditis, you are prone maybe afterwards to, because acute will only last for so long.
Yeah.
And
but
afterwards, you're a little bit more prone to hypo.
Yeah, you'll be prone to thyroid disorders. So it is always advisable to take care of your lifestyle. Do you have any symptoms? Like, what are your symptoms? As in, do you put on weight or you've lost weight? How's the appetite? What is it like?
So during my acute thyroiditis, which I had a couple of years ago, I'd lost a lot of weight. All my appetite was okay. And now I have annual blood tests and it's very normal. But I was told maybe I was eating too much cruciferous foods.
Absolutely. Yeah. So they are high in iodine, and so your thyroid increased, and you have a suffering from hyperthyroidism. Your thyroid hormones increase.
But you know, one of your advices, sorry,
yes, please.
One of your advices is if you suffer from hyperthyroidism, to actually eat cruciferous vegetables.
Please. Yeah.
But the reason I had acute thyroiditis is because I was eating too much cruciferous, like cabbage.
You're suffering from hyper only then.
Sorry,
I'm so sorry. Babaji, up back here, please. Yeah. So sorry, my father-in-law. Yeah. So what we can do, you had thyroiditis because of eating excess cruciferous. Because it is. Just a minute. Up, please, that was because you were eating more cruciferous vegetables, so your thyroid hormones probably increased. But thyroiditis is not something caused by any excess vegetables or something. The cause could be autoimmune. Yeah, the cause, we can't assign the cause to eating excess vegetables. But yes, if you are suffering from hyperthyroidism, these will help you with getting it down, getting your T3, T4 lower.
Okay. So would you advise someone who is a little bit older, who has been diagnosed to have thyroid stimulating hormone, a little bit on the high side, taking cruciferous or not taking cruciferous?
Not taking, because if the TSH is high, that means the T3, T4 are low. That is the reason why the TSH is high, because the pituitary is constantly sending the stimulating hormone because it's finding the T3, T4 low. So that patient is suffering from hypothyroidism. So definitely they need to avoid soy and cruciferous. Soy anyways affects the thyroid hormone in both ways. So it is better to avoid if you are suffering from hypo. But cruciferous, yes, please.
Sorry, it's okay. Finish it.
Cruciferous vegetables are to be avoided if you are suffering from hypothyroidism, if your T3, T4 are low and your TSH is high. But if your T3, T4 are high and TSH is low, in that case, cruciferous vegetables will help you.
Yeah.
Yes,
Thank you.
Yeah. Next question.
Yeah, can I ask a question?
Yes, please.
Yeah, I suffer from hyperthyroid. Yeah, because I'm taking thyroxine, 50 microgram. So that is hyper. But the food wise, I eat anything and everything, but I'm fine. So is it that is hyperthyroidism?
Hypo, because thyroxine is the thyroid hormone which you are supplemented externally.
Yeah.
Because your T3, T4 are low. That is the reason why the doctors have advised you to take extra thyroid hormones.
So that is hyper.
Hypo.
Hypothyroidism. Okay, fine.
Yeah.
Okay. Thank you.
Okay, my pleasure.
Thank you.
Okay. Thank you, doctor. I have a question.
Yes, please.
I have got hypothyroid. Now that's because as a result of an autoimmune condition.
Yeah.
So in such a condition, is it reversible or not, the hypothyroidism?
It is reversible.
It's still reversible, is it?
Yes. Hashimoto's thyroiditis, we have seen many cases where we have been able to successfully reverse it.
But when the doctor diagnosed it, he never made a comment or description like you have got Hashimoto's or Graves or whatever. He never used those terms.
Yeah, it could, but the commonest is Hashimoto's. It could be any kind of thyroiditis, but the commonest cause of thyroiditis, autoimmune thyroiditis, is Hashimoto's.
So when you say no soya, how about soya milk? You know, I have stopped taking cow's milk. I drink soya milk. How about that? Is that okay to take?
Not advisable, ideally. You can go for rice milk, you can go for coconut milk, you can go for almond milk, oat milk, but not soy milk.
What would happen if you continue taking soya milk?
It can interfere with the thyroid hormones in the uptake or metabolism of thyroid hormones. Soy is known to interfere. It's known to interfere both in hypo and hyper. So it is something not advisable.
Okay, because I've heard conflicting things on this. This is why I asked again about the soya milk.
Yeah. Soy milk is not advisable, ideally.
Okay.
You can go for the other milks if you dairies, of course. It's better if you don't take dairy. You can go for coconut milk, rice milk, oat milk, almond milk. There are many options.
Okay, thank you.
Soy milk.
I have a quick question.
Yes, please.
Cassava. Can you just about what's in cassava that can cause thyroid problems.
Iodine.
Sorry?
Iodine.
Oh, it's got a lot of iodine in there.
Yeah.
So avoid it if you've got hyper.
Yes, please.
Thank you.
Okay. Any more questions, please?
Yeah,
Yes,
can I
sure.
bring back you a question, Dr. Geeta?
Please.
Is any of these conditions, the hypo or the hyper, inherited at all? Because my mother used to have it. So is it inherited?
Definitely. There, we usually have this section in history taking. We do ask for the family history because it is known to run in families if your parents or maternal or paternal have been suffering from thyroid disorders, then possibly you can also. Yeah. You might not, or you might. It's not necessary that you will, but there are higher chances that you might suffer.
So should the screening be done on a yearly basis or a bit more often?
After 40, I believe, yearly basis. Earlier, you can make it later. But then after 40, I believe yearly basis is always better.
Yeah. Okay. Oh, thank you.
Okay.
I just thought, are diabetics more likely to suffer from thyroid problems? Diabetics?
Yeah. It is like diabetics are more prone to thyroid disorders, rather hypothyroidism, and hypothyroids are more prone to diabetes as well. So it is both way round.
Okay, that's good to know. Yeah, and is this hypothyroidism or hyper related to B12 deficiency or anything in any way related to B12?
Yes, it is, of course. That is one of the causes, or we usually find patients with B12 deficiencies. We also ask them to get screened for thyroid.
Oh, right, okay. So would you get muscle weakness if you've got low thyroidism, Would your muscles suffer?
If you're hypothyroid, yes, your muscles suffer, your nerve endings are also affected in a way. So, and it is the GERD is associated because of this, because if you are low in the extrinsic factor, the intrinsic factor is affected. Like intrinsic factor is something produced in your stomach, in the lining of the stomach, and both go hand in hand to produce to activate the B12. So if you are if you are deficient in B12, it is important that you get tested for TSH as well, for your thyroid hormones. And if you are diagnosed to be hypothyroid, it is important that you test your B12 levels as well.
So maybe that's why. You see, I cannot take B12 orally. They said because it's not digested by the stomach, so I have to take the injections.
Yeah.
So maybe that could have brought about my hypothyroidism as well then.
Yeah, because if the intrinsic factor is affected, if you give it externally, it won't work. In that case, you need to take injectables.
Yes, and if you take injectables and you then obviously have developed thyroidism because of this B12, is that thyroidism still reversible?
Yes, it is.
It is. So either way, with autoimmune or this is still reversible, yeah?
Yeah.
Okay, so when you do Ujjayi pranayama, how many times do you have to do it to be effective for thyroid?
You have to start very gradually. You don't have to strain your throat a lot. Just start doing it a few times. Once you're comfortable, then maybe some 10 to 20 repetitions should be fine.
Okay, so 10 to 20 a day, yeah?
Yeah.
Okay, thank you so much.
My pleasure.
Thank you.
Welcome.
One shift of time, and thank you, Dr. Geeta, for even taking that much time longer. We have a HomeoHealth Hub. If there are still more questions, please don't hesitate to write there. And we will see Dr. Geeta again anyway in monthly meetings. She responds very quickly. She also shares her contact details if you need to book her private consultation, free consultation, or get to know more about the program she just mentioned. So please don't hesitate to do that. Thank you. Thank you, Dr. Geeta.
So much. And